Hi everyone. Just going to do a vlog on my experience, my symptoms mainly of AML. That's acute myeloid leukemia. Well, what I explained before I start is that if I lose my words, it's due to the chemo that I've had because I've had so much of it. I do actually start to lose my words. But I've got a few notes here, so if you see me looking down, it's because I have a few notes just to look at to jog my memory as we're going along. But what I want to do, I want to start not realizing this, but after actually writing down my symptoms started back in November 2023, going into December of 2023, and started off with like pins and needles in my feet. Now I did go to the doctors because I was a bit bothered really, pins and needles in my feet when I was walking. It felt like I was well, walking on pins. And the doctor, from his experience, told me that it's because my shoes are the wrong shoe. So I changed my shoes anyway on that. And these pins and needles didn't go away. They remained, but they run up my legs as well. And I went back to the doctors, and my doctor checked obviously my nervous system around my legs, which came back, it was okay. But I went for a second opinion to A&E because I was concerned. A&E obviously did the same, checked my nervous system, said I'm okay, I can go home. So I went home. Now that's 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 um that's where I think it all started really, because then in January I I started to feel dizzy. Now I'm going to explain the dizziness, how it actually came about. I was in work. I was in I was in in the room with somebody, and the room seemed to move sideways, and I broke out in a sweat, and I felt that I was I was I was having a dizzy feeling. And I said said that I have to leave. I'm not feeling well, so I left. And I got in my car and I drove to my next customer, parked up outside their house, and it happened again when I was parked up, but the road moved sideways. I got a sweat and I felt dizzy. So I phoned work up, explained to them how I was feeling, and I needed to go home, which was authorised. I could go home. So I drove slowly home. I got home, said to my partner when I came through the door, I started feeling a bit dizzy. I'm going to have to go to bed and just rest a bit, which I did. Woke up a couple of hours later and I felt okay. So I phoned work back up and said, I'll definitely come back in tomorrow because I'm feeling all right. So I went back into work. Now, I was getting dizzy spells, like when you bend over and you get back up, you know that you crouch down, you get back up, and I was getting dizzy spells more than normal, really. And I went to the didn't go to the doctors with the dizzy spells because I suppose I could find reasons for being dizzy and put it down to like being hungry, or I got up too quickly. and things like that. So I didn't really go to the hospital because of them. Now, about 2 weeks later, we got into February. Now, this is February 24 now. So January 24. I was still getting dizzy spells in January 24, but I drove. We arranged to go skating, the family, and we decided that we would drive to Longsight in Manchester. I drove my car and my missus down there, and Sonny, his partner, drove the kids down there. Now, everything was okay. I'd driven there and got out of the car. We went into the skating, but we was told that the skating time was a 3 hour slot, and we'd missed it because it was private party functions after a certain time. So we discussed outside, what should we do? We might as well just go home. Now I walked back to the car. I got into the car and I broke out, dizzy spell, a sweating spell, a sweating from the head. I removed my jumper to cool down a little. I was actually parked up in the driver's seat, ready to drive back home when this happened. And what happened is I lost consciousness and I was sick. Now, I remember my partner bringing me around, talking to me, giving me gentle pushes and what have you. And when I came round, she told me that I'd been sick. And I was like, well, no way. You know, not knowing anything about being sick, just passed out. That, I suppose, really, when you pass out, you don't know anything that's gone on or going on. So she drove back, but we ended up going to the sons and the partner's house because it was closer than going to our house. I lay down. I sipped on blackcurrant juice, sweet blackcurrant juice, just to hydrate myself. And I said to my partner, I said, I think the best thing to do is that I phone 111 to explain what's just happened. So obviously she phoned 111. I spoke to the triage nurse, explained to her what had happened, and she said that a doctor will get back in touch with me. Now this was Saturday night. By the Sunday morning, the doctor obviously returned the call. I explained to him what had happened, and he told me that you need to go to A&E with that. So that alone sort of like struck alarm bells as well. That the doctor's saying you need to go to A&E. So I went to A&E, and I had blood tests taken. Obviously, all my observations was taken, and about 3 hours later, I was told that they believe I had food poisoning, which I accepted because I thought, well, yeah, I did have a chicken takeaway. I didn't tell the hospital that I'd had a chicken takeaway. I think more or less I'd forgot all about it, but I did have a chicken takeaway on the Saturday night before we went skating. So obviously it all adds up. So obviously I told you can go back home now. Now the thing is that I was still having these dizzy spells also. And about maybe a week, 2 weeks later, after being told by the hospital that they think I had food poisoning, I got a text message from my GP. They'd set up another blood test for me that that I needed to go to, and they checked my rotor to see if I was in work that morning. I wasn't in work. I was on an evening shift, so I decided that I'll go to this blood test, and it was like taken at a chemist. It weren't taken in the GP itself. The blood test was taken at a chemist. So 2 days later, I got a phone call from the doctor that my blood test was back, and to come in and see him. And I went in to see the doctor, and the doctor told me I was neutropenia. Not understanding what neutropenia was, he explained to me that it was a low white blood count in my neutrophils, and at the time it was 0.5. And I asked him, should I have time off work because the people I work with are actually coming out of hospital and they could be carrying infections? No, you can go in work, just try not to get an infection. I was stunned at that part, that he wouldn't give me any time off work to find out what was wrong with me properly. He just told me that my white blood cells would come back 28 days, 2 months, 3 months. So he wouldn't give me a sick note. Now, I went to work in the evening, and luckily my manager was still there. I explained to the manager, oh, wait on. I walked out the doctors. I walked out onto just come out the front doors. I got a phone call from the housing agency where I rent the house from, and I was told your landlord is selling the house. I was like a double blow, really. I've just been told I'm neutropenia. Don't know what's wrong with me. Now the landlord's evicting us, and we've got nowhere to go. And I think it was more of a shock than anything else. So I'll get back to the work situation now. So I went to work in the evening, explained to my manager that I was neutropenia. I don't have any white blood cells to fight infection, and I've got 5 days annual leave left, which I was going to carry over to the following year. And as I said, can I take them as an emergency now so that I can go to A&E and start the ball rolling, because I'm neutropenia and I don't know what it entails, and my doctor's telling me I don't need to be on the sick because I'm not ill. Now, if you're talking from where I would be speaking from, I'd be thinking more prevention, me. Yeah, go on the sick, don't come in contact with people, and we'll wait and see if your blood cells come back up. Anyway, my manager was okay with this, and I went to A&E at the night time. They took my bloods again. They did my observations. It's a long time waiting, isn't it? And the doctor came back to me and told me once again, you're still neutropenia. There's no change. So I asked him what it meant, because I work with people coming out of hospital, and should I be on the sick? And he told me, he even said to me, well, because you're not ill, no, you can go into work. So a few things started to happen then. Started to get infections in my nose and in my ear, and they started scabbing up. So I went to the hospital I went to my doctors regarding this nose problem, and the doctor gave me a sick note for 7 days for abrasion in my nose. Now, I went to the hospital after the doctor gave me the diagnosis. It's an abrasion in your nose, which I weren't convinced. I thought it was an infection more than an abrasion. So I went to the hospital for a second opinion. The second opinion was the same, and the same result was that you can go home because you're not ill. So I went back home. The dizziness was getting worse, and I wasn't really concerned about the dizziness at the time, because obviously I didn't understand everything that was going on. Now, a few days later, a couple of days later, I got an infection in my stomach, loose stools, and I went to my doctors. My doctor prescribed minestrone soup. Eat plenty of minestrone soup. So I ate plenty of minestrone soup, and obviously it just went straight through. I went to the hospital, and the hospital checked me over again, took my bloods, still come back, your neutropenia. I wasn't ill enough with having obviously an infection in my stomach, but they did check for obviously stool samples and what have you, come back that it wasn't an infection, it was just loose stools. So they could put me on the tablet, because it's not in my head. But anyway, they put me on tablets to slow my bowel movement down so that it'd go right. And that's the part when I have to think about something, because of the amount of chemotherapy that I've had. There's so much chemo. It's hard to think about a previous medication and things like that. That's the big effect that the chemo has actually had on me. So, and I can even lose myself now and forget where I'm up to. So the doctor obviously didn't keep me in because I wasn't ill enough, and he sent me back home. And I'll come back to the dizziness was getting really bad. So I went to my doctors with the dizziness, and because I had a 7-day sick note, they weren't prepared to give me a longer sick note. So I went to A&E, and I seen the doctor in A&E. They took my bloods again. They did all the checks, they did the observation, and told me I'm still neutropenia. And I can go home. And my reply to that was, well, I'm not going home until you do something about it, because you have a duty of care, just as I have a duty of care in work. And what I'm saying to you is this dizziness it's not the room spinning round, and it is a movement from me and a dizziness that I can't really explain, but there's a dizziness. I'm neutropenia, we have no white blood cells, and I need comfort. I need some. I say I have to think of the word now, but let's just say some confirmation on what is going on in my body. And the doctor went away for about 15-20 minutes, and then he came back to the room, and he said to me that I've had a word with the team, and we think it's right that you go to the hematology outpatient. So we've sent the notes down to hematology, and you should hear within the next couple of weeks. Now, my 5 days annual leave was coming to an end by now. So I did a 7-day self-certified sickness then. And within that 7 days, the hematology outpatients got in touch with me with an appointment. Now, I went to the hematology outpatients. They started with blood tests, and I'm talking weeks of blood tests, checking, looking to find out why I was neutropenia. And it just kept coming back. Your neutropenia, they couldn't find anything in my blood. So they said the consultant who I had at the time said to me that the only way we're going to find out is by a bone marrow biopsy. Now, I'm talking February, March, April, May, before I actually had a biopsy. I had my biopsy in May, and by June, so it was late May, by June, beginning of June, the result came back, and my appointment changed from hematology outpatients to hematology ward at Oldham Hospital. So I went there for the result, and I was told that I have acute myeloid leukemia. And it was explained to me about the acute myeloid leukemia that there's no warning signs, there's no build up to it. It's like turning a light on. It's there. Now you do get chronic, and chronic is like a longer term of a build up to getting leukemia and things like that. So the thing is mine was there. Bang, you've got a blood cancer. So now this is 6 months down the line now from at least January when I started looking into things. And just let the chemo pass by. So I was 6 months down the line by the time I been diagnosed with acute myeloid leukemia. My question was mainly, would you be able to get me into hospital before I'm ill for treatment? And they told me that they could get me in. It'll be 2 weeks. But at this point, they started to give me some kind of medication, antibiotics, kidney tablets, everything to support my innards of like my lungs, my kidneys, my liver, and everything like that. Now, beforehand, I didn't have anything because the doctors didn't know what they was treating. The hospital didn't know what they was treating. All I was, I mean, I did get a signal off the consultant when I first saw her, and on the consultant said to me, it's an hospital investigation. So I was on the sick, long-term hospital investigation. So they did get me into hospital. within that 2 weeks, and they started me on the chemotherapy, which washed me out. It cleaned me right out. I was ill. I was ill from it, and they told me that we've got to make you ill before we can make you better. And I was ill. I couldn't walk, couldn't do anything. I couldn't even get out of bed. I was really, really, really gone. And when you think about it, I had leukemia for 6 months with no tablets, no assistance from any medication, just picking up infection after infection. So it floored me. It totally wiped me out for 6 weeks. And I started to come round after 6 weeks. And I'd lost lots of weight. I'd fallen from 11 stone to like 9 stone. I had no muscle on me. It had all fallen off. And I had to rebuild my leg muscles and try and get fit again by eating food. Now, after the first chemo, I was in remission. About 3 weeks later, I went back in for another course of chemotherapy. After that, I had another biopsy, and that again came back. I was in remission. So I had all my white blood cells back. I had obviously my own bone marrow. I had everything, and I was in remission. But I was told that because my bone marrow and my white blood cells was already friendly with the leukemia, it would only pop its head back up and obviously attack again and just take its place where it was before the chemo. So they suggested that I go for a bone marrow stem cell transplant, which came around about December 2024. I got a donor from Germany. He was only young. He was in his 20s, and I had the bone marrow biopsy, bone marrow stem cell transplant in December. I was very ill again. The chemo wiped me out again because it was even stronger than the chemo I had at the previous hospital. December, January 25, things seemed to be okay after my bone marrow biopsy. All my bloods were showing that everything was okay. By February, my white blood cells started to drop again. I think they call them chiromisms, and that's the level of antibodies that come from your donor. Now, they was coming down. I shown that I still have 100% bone marrow from my donor, but the white blood cells were being laser and not coming from the bone marrow. So February, I went for another bone marrow biopsy. They still shown I was in remission, but they were coming down. Now the plan was that I have a boost from the white blood cells of the donor. But I had to wait another month till March 2025 for another bone marrow biopsy to see what had actually is happening. And it came back that the leukemia had come back. So then I wasn't allowed to have the bone marrow stem cell booster. So what happened then is that there was talk regarding the next step in treatment, which was some chemo injections for 7 rounds, 7 days, and 28 days chemo tablets. And this would put me back into remission. And from that, I could have a stem cell booster from the donor. But on the other hand as well, they did say that we will ask Christie's if they have anything, trials coming up or anything like that, which I could go on. So I agreed to it because it's the right thing to do, because any help is better than no help. So what happened is Christie's took a sample of my last bone marrow biopsy from March. They tested it and they came back to me and said that my bone marrow, see, medical terms now I'm thinking of, my bone marrow is a match for either trial that they've got going at the Christie's, and they had 2 trials. I could go on either one of them two, depending which one came up first. Now, I did get in that time an infection in my Hickman line, which was, it went in through the top of the neck and then it came out somewhere around about here. So it was straight into the heart. And I got an infection in it. Now the infection obviously hospitalized me for 6 weeks. I got ill again. I was in a bad way. And Christie's got in touch with me during this time and gave me an appointment for I've lost my dates for July. So May I was in hospital, and June I was in hospital. But end of May, beginning of June, and they give me a date in July the 8th, to go and speak to them regarding the transplant. I did speak to the consultant at Christie's, and I did ask the consultant at Christie's that if I have chemo and chemo tablets at the MRI, would it actually affect anything going on at the Christie's on the trial? And my consultant at Christie's said no, whatever the MRI do with you will not affect what happens at Christie's. So with that knowledge and obviously my consultant at the MRI, I did explain to her that I could have the chemotherapy here and I can have the injections here, because whatever you do here regarding chemotherapy and the tablets will not affect anything that's going to happen at Christie's, and you can phone her up and ask her, which she did do, and came back with that they will start me on some chemo injections and the tablets. So started me on them, and I only had 7 days. I had 5 days injections, 2 days off, and 2 days injections the following week. I had tablets for the same period of time. But they had to stop it because I had to be cleaned out from that for when I go for the treatment down at Christie's, being the antibody treatment. So when I went to Christie's, obviously on the 8th of July. They told me that would be the 21st of July when I would start the treatment. I needed to go in and have a bone marrow biopsy on the 10th of July, which I did do. And I got the result, obviously, on a week later. And I asked them about my 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 pointers or my score line in my bone marrow from my last biopsy, because I had chemo in between. And he said that he explained to me that since you had the chemo, the numbers in your bone marrow had come down, and the better than I was before you had the chemo. So I went into the trial with lower numbers than I would have done if I wouldn't have had the chemo. They would have been higher. So that's where comes the 21st of July. I have my first antibody treatment, hospitalized for 24 hours so that we could check my bloods throughout the night, throughout the day, throughout the night, for 24 hours really. Took lots of bloods because they need to find out what the level of antibodies was in your body. And that all went well. I got through it. Everything was okay. And then on the following day, everything was still okay. You have to do a memory test. I did it the day before, and I had to do it the day after the antibody treatment, which went okay. I remembered everything, even with the chemo brain. But that's where I'm up to now. That's it. I go back in. I think it's on the 14th. No, I think it's the 4th of next month for some more antibody treatment. It's every fortnight that I go. So that's the 4th of August. But what I want to say before I go is that not all symptoms are the same with everybody. What symptoms I have doesn't necessarily mean that other people have had the same symptoms. But the people that I've spoke to who have had acute myeloid leukemia, I think the biggest symptom was bruising in the body, around the body, anywhere on the body, and not knowing why they bruised so much, and they haven't really done anything. But that's one of the main symptoms that speaking to people that they've experienced. My symptoms was mine, and I want to just explain that I probably didn't say it at the beginning. I drank as a teenager, I smoked as a teenager. I gave it all up, 20s, and I eat well. I eat vegetables, I eat fruit, I've eaten everything really. I've just tried to keep my body as fit and as healthy as possible. So acute myeloid leukemia, I told you, it's like a light, comes on, you've got it. Anyway, I hope this helps, and I'll say bye for now. I'll see you in my next video.